All right, we are going to chat a little bit about the National League for Nursing Foundation. A little bit about it is it was founded in 1893, and they have a long history of promoting excellence in nursing education and supporting for future nursing development of nurses. They play a big role in accreditation for schools. Their focus is to maintain continuity of educational material taught so nurses come out on the same knowledge-based playing field, ready to perform and administer appropriate care across the board. So basically, it's like if you go to Costco anywhere outside the world, you know what kind of Costco you're going to get because it's Costco. Kind of a dumb analogy, but you get the idea. So you go to another hospital outside of your state, you know that the nursing care is the same standard of care where in your state. It's across the board. They focus on faculty development as well. So I think it's important for them because they help develop nurse educators, which lead to the development of nursing students in turn. It's just this positive cycle of education. So, and then they also have a global reach of, they're based in the United States, but they are also involved in nursing education globally, and they support international standards and best practice. So even though you might go to some third world countries, they try to implement best practice and safety there. I know like my mom traveled a lot with Operation Smile to third world countries, and they did have the education required to be a nurse and implement standard precautions and best care practices, etc. But the problem was they lacked the resources to implement those. For example, access to gloves, access to PPE, anything like that. So that's another topic to discuss, but mostly just know that the NLN is stepping outside of United States boundaries to implement safe nursing practice. So this membership is open to anyone who is a nurse, anyone who is a nursing student, nursing organizations, nursing faculty. There is a fee to join. The cost varies based off the level of membership you would want to join. The regular membership, I'm going to read this one, is about $100 to $150 annually for nurses and nurse educators. And it really isn't a huge fee if you think about it. The resources involved with all of that, I mean, you have limited resources at your fingertips, access to newly published nursing articles, things like that. So I feel to maintain best practice, it is probably best interest to be a part of the NLN, in my opinion. I think I'll choose to going forward. Just knowing that I'm providing top care for my patients, new up-to-date evidence-based practices, and also protecting my license because I am implementing the newest evidence-based practice and best nursing practices. So let's see here. So the NLN is also involved in legislative advocacy. For example, nursing education, they advocate for policies and funding to support nursing education and faculty development, which is huge. We forget that sometimes those are, we just think it happens, but it doesn't. You need an advocate like the NLN to continue to push for financial funding, etc., so nurses can continue their education beyond graduation. As we know, continuing education is a huge part of nursing, as evidence-based practice is always changing and science is always uncovering new ways to treat patients, different practices. So they also address workforce issues. They address issues related to the nursing workforce, such as staffing, education, funding, and diversity in profession. I will say that the staffing is still an issue. So that is something I would like to further my research beyond this video of the issues with proper staffing in America in healthcare settings. I have worked as a licensed practical nurse for 2 years, and I can tell you that it is a huge issue. I don't know if it stems at corporate where it's just a greed thing, or if we truly are lacking resources to staff. But I don't think that's the case because nursing education and employment is on the rise. And by 2030, it's projected that nursing will almost triple what it is now, which would mean, it's good for our economy because now we're going to have nurses to fill those roles, but also a little bit more competitive environments for nurses and jobs. So, good and bad. Let's see here. The NLN, they do have journals and publications, and I think that's important for accreditation. You don't have someone just throwing out just nonsense, non-peer-reviewed articles to help support their claims and causation. A couple of examples are the Journal of Nursing Education. They're peer-reviewed, and they publish research, best practices, and innovative strategies in nursing education, so they're known for that one. The NLN position statements, they regularly release position statements on various aspects of nursing education, practice, and policy. These statements help guide nursing educators and influence healthcare policy, which is great. And then NLN publications, the organization offers various reports, research papers with a strong focus on educational materials to support nursing educators and institutions. Keeping that education standard bar to where it's at and raise it even more and not allowing that to drop at all is important to maintain knowledgeable, competent nurses. So I do appreciate the National League for Nursing and any other national health societies that are out there. Speaking of, so we have, I'm sure a lot of you are familiar with the American Nurse Association. If you're not, let's just touch base on that. There are human rights in nursing. They focus on the importance of advocating for dignity, autonomy, and rights of patients. Having been a patient myself multiple times in various medical aspects, I am grateful for the American Nurses Association. A lot of times patients don't have advocacy, and this is a key component to helping the overall patient in healing. So there are 5 key points from the ANA's position, American Nurses Association position, on human rights and future practice as clinicians. Patient autonomy and informed consent. We need to treat each patient as individuals as they are, not as, for example, I had a patient come in from the emergency department, from the jail. And it was really hard to not at first want to throw bias toward the patient because I knew what they were there for. But instead I saw the patient as a whole and holistically to care for them in my best interest and the patient's best interest. Equity and access to care. Everyone should have equal access to health care regardless of their background, socioeconomic status, or other factors, which I strongly agree with. Confidentiality and privacy. We all have all heard of HIPAA. They really enforce that. Non-discrimination, respect for diversity emphasizes the need to provide care that respects the diversity of all patients, including cultural, religions, and individual differences, which can be hard at times if we don't have agreeing opinions, but at the end of the day, it is their body, their choice. We just need to work with them in best practice. And then we have advocacy for vulnerable populations, which would be people with like dementia who can't advocate for themselves or maybe taken advantage of by loved ones. It's important to maintain professionalism in nursing, not only when you're representing yourself as your license, but your hospital that you represent, and you show to them by being professional that you are competent in caring for their every need in healthcare, and they pretty trust in you, and you need to respect that and continue your professionalism in nursing. All right, we are going to chat